All right, we're gonna end chapter 13 tonight with blood pressure. So first I'm gonna start with normal vital signs. All right, so normal vital signs for adult for the normal blood pressure would be 120 over 80, 120 being the top number, 80 being your bottom. For kids, for infants, which is up to 6 months, it'll be 87 over 105. For toddlers, which is about 2 years, it'd be 95 over 105. And then for like the school age kids, which is like a 7 year old, it'd be 97 over 112. And for an adolescent, which is a 15-year old, that would be about 112 over 128. Some normal vital signs for adults for heart rate. Females would be 55, well, kind of in between 55 and 95 for your beats per minute. And normal beats per minute for a male would be 50 through 90. Respiration rate, I'm sorry, for adult is about 12 to 18 breaths per minute. And for children, the infants is about 30 to 60 breaths. Toddlers are about 24 to 40 breaths per minute. Preschoolers are 22 to 34 beats per minute. School age kids, which again is about 7, they have about 18 to 30 beats per minute. And for your adolescents, 15-year-olds, it's 12 to 16 beats per minute. Let's go over the ABCs of blood pressure measurements. A. A is for achieve a calm state. So you just make sure you're quiet and relaxed. Let them know that they need to sit calmly without talking for about 5 minutes. And make sure your reading isn't affected by caffeine, alcohol, exercise, or smoking. Meaning you don't want to take it right after they had a Coca Cola, coffee, had any alcohol before coming to the dentist. If they've just left the gym, give them a little while, give them about 5 to 10 minutes to cool if they're like straight from the gym, if their gym is close to your office. And smoking. If your office even allows smoking outside the building, which most offices does not, um, if they come in and they smell like smoke, give them a couple minutes before you take their blood pressure. Um, B is for body posture is important. So they're gonna sit in a chair with their feet on the floor. Legs should not be crossed like this, down there. Everything should be flat, even. And arms should be bare and should be supported at heart level. Okay. C is for calibrate and check equipment. Use a properly calibrated and validated instrument, which uh, if you had it for a while, then you probably would need to get it calibrated, especially if you've like dropped it a couple times. Um, I've even heard of a case to where somebody lived on a bumpy road and they kept it in their vehicle, and just the bumps kind of threw it off, and they had to always get theirs recalibrated. You also want to check the cuff size and make sure that it fits. Do not try to put a kid's cuff on an adult or vice versa. The readings will always be off. And D is for double check any high readings. If blood pressure registers high, take two readings 5 minutes apart. Okay. Also confirm any elevated readings in the opposite arm. So, meaning if we use the right arm, it's a little bit too high, so we wait our 5 minutes and then we do it a second time. If it's still high, go ahead and try it on the left arm, okay? Just to see if the readings are even close in the same ballpark. If it is, then their blood pressure is high. If it's not, then you might want to go get someone to see if they can come double check over you, or just go ahead and see if you can get another, to see if that one will work better for you. Measuring respirations. Respirations is the process of inhaling, which is breathing in, and exhaling, which is breathing out. Let's see. One. No, we can skip that. Skip that. Yeah, that's fine. I don't really need to know that. All right. Stethoscope is an instrument used to listen to sounds produced by the heart, lungs, and any other organ. Okay. We can skip those. And it's not anything important, y'all. I've already went through all of this, and I have a lot of stuff underlined and highlighted. So I know what I really want to talk about. Okay. Measuring a pulse rate. Pulse rate is a measurement of the heart that is measured in beats per minute. Another definition of pulse rate is the pressure that can be felt in the artery every time the heart beats. Only reason why I read the other one first is because not all times you can feel a heartbeat in the artery. If a patient is severely overweight, you might have a hard time finding it. Um, Also, if their blood pressure is super low, their pulse can be a little weak, and you might not be able to feel it in there either. So, I just always just like to say pulse rate is a measurement of the heart measured in beats per minute. You know, you always check that. Uh, Pulse rate is affected by many different factors, emotions, which that's all across the board, anger, anxiety, fear, sad, like all of your emotions can affect your blood pressure for the better or for worse. You never know. Um, some other things that can affect your pulse rate is exercise, which we said earlier, body temperature, air temperature, body position, pain, medications. As far as your body position goes, uh, you always want to get them sitting feet flat, like they said earlier, everything at heart's rate. You don't really want to take a blood pressure while the patient is laying down on a bed. Let's not do that. They can be sitting up in the bed with their feet flat on the ground, but do not take it when they're laying down. You know, it's kind of the wrong time. Definitely do it before. Blood pressure is a measurement of the force of blood. I'm sorry. Blood pressure is a measurement of the force of the blood flow exerted against the walls of the artery or vascular resistance to blood flow. Blood pressure is affected by the strength or force of the heart's pumping, the ease with which blood flows through the arteries, and the amount of blood that pumps through the heart each time it beats. Factors that can influence blood pressures are also exercise, medication, pain, emotions, age, sex, stress, the amount of blood in the body at one time. All of those could all be factors of your blood pressure. Um, and again, blood pressure is the top number and the bottom number, which top number is systolic and your bottom is the diastolic. Um, let's see. Measurements consist of two numbers: systolic, which is the heart contracts. I'm sorry, when the heart contracts, uh, and diastolic, which is when the heart rests. And it is measured in millimeters of mercury. So you always see mmHg, millimeters of mercury. Blood pressure readings can vary within the same person from minute to minute. So again, if you take it, it's kind of high, wait 5 more minutes, let them cool a little longer, take it again. Then if it's still the same super high, swap arms, you know. Normal values are given in ranges. Hypertension is abnormal high. I'm sorry, abnormally high. Hypotension is abnormally low. And hypertension is slightly higher than normal, which would be creeping up into your high blood pressure. All right. We can skip that too. That was it, y'all. Okay, so yeah, that is it with all the notes. So I want y'all to kind of make a chart like this. Okay. It doesn't have to be exactly like this, but try to make your little chart with your systolic and your diastolic. Okay. And I'll read this to you, but try to make it out like this. It says pre-hypertension, hypertension, stage 1, stage 2, hypertension, crisis, normal, and hypotension. Okay. And this is your systolic and diastolic, MMHG. Okay. Remember, I always have that. And so, what you're going to do is label with correct blood pressure, then describe and explain actions, if any. Okay. I'm going to post a video on here, and I need for y'all to do that. So the video will be basically of different heart rates. You'll hear different heart rates, and I'm gonna need for y'all to label them. Okay. So for the first blood pressure, you're ready right there. And if you have any kind of notes on it, describe what your note is, what you heard. Okay. I'm gonna actually send two videos. The first video I send y'all is going to be um, kind of like a crash course of the blood pressure. It'll show you what to listen for, when to keep track of your number, or when to write down the number. I'm sorry. That way, everything is kind of in the same ball field. I'll send that one first. Watch that one, get a good grasp of what's going on, and then I want y'all to do this little chart that I just showed you. And at the end of the video, I need for y'all to go ahead and put your answers. You can either take a picture of the sheet of paper that you wrote out, post that for me to grade, or just go ahead and type everything in the comment section, okay? All right, ladies, good luck, and I will see y'all tomorrow. Bye.